pouring into the room. Meanwhile, let me just tell you what we're talking about today: how to make six figures in your own healthcare business. That's right. You can work from home or from Hawaii or anywhere else that has an internet connection and serve doctors in your community, helping them to stay in private practice and increase their revenue. And to verify that today, we've actually got a guest today. I'll be introduced to her in just a moment, Dr. Vicki Rackner. Been on one of these webinars, you don't know who I am. My name is Patrick Phillips. I am the founder of American Business Systems. We started this company 27 years ago when my wife and I started actually doing billing for doctors here in the Dallas-Fort Worth area. At one point, we got very successful at that. People wanted to know how we were doing it. We developed a training program to teach other people, and then we sold all of our accounts so we wouldn't be in competition with our people that we were teaching and training. And that's all we've done for the last 20 some odd years, is teach and support people on how to go out and find clients and make a six-figure income working from home. So basically what we do is we provide to you an entire training package. It's kind of like a franchise, but it's not. It doesn't have any restrictions on territories. There's no monthly, residual royalties that you have to pay us. There's a one-time initial training fee of $28,000. Just like a franchise fee. Yes, it's a lot of money, but it's a lot of money that you can make too. So you get what you pay for in the franchise industry. Okay, so we give you a cloud-based system that you're seeing here on the screen, illustrated on a computer screen and an iPad. These are screenshots of our electronic medical record system. We have a billing system, of course, that's all built in there. Anyway, the whole thing is cloud-based, which means you can log in from any computer anywhere in the world. Nothing is downloaded to your computer. There are no updates. There are no patches or new codes that you have to download. This is all taken care of by us on our end. We have servers in several parts of the country and different electrical grids of the country, so that if one goes down, the other one goes back up immediately and you never know it. So we all do all the backup for you. All the patient data is stored there, so it's HIPAA compliant, and it has won all sorts of awards from some of the organizations that you see here on the screen. Let me make sure that I'm actually sharing all this. Yeah, okay, I see that in my little preview up here now in GoToWebinar. So it's a very solid system. All I can tell you is you need to go to our website that you see at the bottom of the screen there and search out more about it. By the way, in addition to iClaim and EMRX, the billing system and the electronic medical record system, we have 7 other services that you can offer that are available to you as our licensees at no additional cost. They're optional. You can use them or not use them. You can offer them or not offer them, and you can make money on each one of those as well. Again, my name is Patrick Phillips. I'm the founder of the company. I am also an author. You can go out to Amazon and find my books here. One of the latest ones is right there in the middle, The New Thriving Medical Practice. We'll be talking about that today with my co-author, Dr. Vicki Rackner. I'm also on the editorial board of the Billing and Coding Advantage magazine. You see that illustrated here. It's a print magazine, goes out to 40,000 people a month, and I have articles in that on a regular basis as well. Now let me introduce Dr. Rackner before I bring her on here live today. She is a fellow of the American College of Surgeons. She's also an author herself, has lots of books that are out there. There's one of her latest there in the middle of the screen, The Myth of the Rich Doctor, which we'll be talking to her about a little bit later. She's also the founder and chairperson of the Medical Revenue Management Association of America, which certifies all of our licensees that go through our training. She's also been interviewed on all sorts of TV and radio programs on the internet. She's a blogger. She speaks in front of organizations of doctors all across America. She's in big demand, and we just happen to have partnered with her to help our licensees and introduce them to the doctors in their community. Like I said, she also has articles herself in Physicians Money Digest, a Journal of Medical Practice Management, and many others that are out there. With that, let's bring her on live. Dr. Rackner, you still with me?
I am, Patrick. Thank you so much for the invitation. Hey, big news I haven't told you. I just got invited to speak in Vienna at a medical meeting in November.
Oh, you're kidding.
Serious.
Well, my wife and I will want to go with you on that just to sit and listen to you.
You're cordially invited.
I think Vienna is one of the rare countries in Europe that we have not been to. But my wife wants to go just so she sees how people live, on boats.
Excellent, excellent. Well, we'll just plan a big trip together.
Yeah, that'd be great. Well, I just thought I'd show people a picture proving that you really are a doctor. You didn't know I had that one, did you?
Uh, well, I just sent it to you. So yes, you do. That's my
Is
surgical residency program. So I was a graduate student. I fainted on my way to the bathroom one day. I was bleeding internally. And after my emergency operation was over, I decided I wanted to be a doctor, save other people's lives like my own had been saved. And so I went through medical school, and not surprisingly, I became a surgeon. And this is my training program. It's so nice to see all these faces.
well, that was a few years back, wasn't it? You've seen lots of patients since then, haven't you?
I sure have. Yes, I did. I think that was 1989.
Let's just say 1980 something.
Okay.
Yeah. Hey, by the way, one of the things that you said to me early on when we first met, I'll never forget this. In fact, it's in one of your books, I think. But anyway, you said the physician's pain is your opportunity. And I wasn't quite sure what you meant by that until I realized that you had been helping financial advisors all across the country to connect with doctors. In other words, how to get in front of doctors to talk to them about their finances. And obviously, that's a big pain that a lot of people have who are trying to market to doctors. I've known people who've gone into medical billing and they never got a client because they didn't know how to market to the doctors. So we're
Right.
just thrilled that we're thrilled that we have you on board with us as partners.
Well, thank you, Patrick, because this is really, really key. It's understanding that you, as a business person, I mean, you're here because you see a business opportunity, right? So you are actually wired differently than doctors are. And so really understanding how to attract and engage doctors in a way that works for them and sort of push their buy button is really important. It can be the difference between struggling and true success in this industry. And that's kind of my expertise. That's my secret sauce.
Yeah, and you've been doing that with the financial advisors for many years, even before you met us. And I think we've known each other for what, 5, 6 years? I forget.
I think we're at 7 or 8 now.
Oh, really?
Yes.
Man, time goes by when you're having fun, isn't it? Now, this chart that you sent me today just blew me away because I never realized that there wasn't a survey that had been done with private, I mean, principal, what's the PCP?
Um, Primary care
Yes,
physicians.
yes, I knew that. Primary care physicians and specialists answered this survey. And look at this, I couldn't believe this. When will you return to pre-COVID income levels? Some of them say next year, and most of them say in 2 to 3 years it's going to take them to get back to their pre-COVID income levels.
Yeah, so
Why
Patrick,
is that?
if I might just provide a little background. So
Yeah,
this has been a very interesting year and a half, right? I mean, everything that we're doing is an effort to make sure that the demand for healthcare services doesn't exceed the supply, right? So we don't flood the hospitals and the emergency rooms. Well,
right.
every time I operated on a breast cancer patient, I had to put her on a ventilator, right? But the hospitals say, no, we want all of those ventilators going to COVID patients. And so elective cases for many months were just put on hold. And these elective cases are the engines that drive profitability of individual practitioners and of hospitals. So, like the Mayo Clinic, the single biggest employer in the state of Minnesota, was projecting about a $3 billion with a B billion-dollar loss for 2020, and they responded with across the board pay cuts. Doctors were furloughed, doctors were terminated. And I will just tell you that maybe as a business person, you've gone through business downturn before. So you've got the tools and skills to navigate through this. But never in doctors' wildest dreams did they ever imagine that the income from this year would be less than the income from last year. And this has really thrown many doctors for a curve. So I'm a fellow of the American College of Surgeons. That's sort of my professional home base. And they were sponsoring webinars with titles like Economic Survival Strategies for Surgeons. And it's sort of like, am I in an alternative reality here? I mean, this is unfathomable. And see, the thing is, doctors don't really have the skills to get themselves right. Now, through my relationship with Patrick, I have come to understand the billing challenge, right? That insurance companies reject about 30% of claims that doctors make. And then a lot of doctors get busy and they say, oh, later, later. And one time my CPA even told me, hey, this is great. You've got rejected claims. Let's write it off as bad debt and lower your taxes. But the thing is, that's not a smart business move. And if you're wondering, how are you going to get more money? Well, think about the general surgeon I know who has $1 million in accounts receivables, right?
Wow.
Imagine how her life would be different if she got somebody like an ABS licensee to really go collect what she's truly owed.
Yes, and speaking of that, here's another chart you sent that basically says, ask the doctors which would help most to reduce your burnout. And the very top one, the biggest one, is increased compensation to avoid financial stress. That's what's burning them out. That's what's stressing them out, right? Is their
Right.
incomes have dropped drastically through the whole COVID thing. And even before that, Vicki, we had a lot of doctors tell us that that is their biggest problem that they struggle with, is trying to get their cash flow where it needs to be. Wonder why that is. You even wrote a book about doctors thinking that they were going to be rich and they're not, huh?
Oh, you mean the myth of the rich doctor, Patrick?
Yes,
Or
that one, right.
the money mistakes that doctors make. And I'll tell you what, because people have invested their time, how about if we share with them a digital copy of these books so that they can read it on their own and really understand doctors and their relationship with money?
Good. I'll be glad to do that. In fact, stick with us till the end of the webinar, folks, and I'll tell you exactly how to get that digital copy of her book. Okay, I have a quote here from Dave Ramsey. I don't know if you've heard of him, but he is a famous guy that teaches people how to handle their money. And he said in one of his books here, the worst thing that we can do is to get a second job. The best thing we can do is to start a home-based business. Now, I'm quoting that because that's what we're all about, of course, is helping people get their business started. And yes, folks, we're going to show you today that there is 6 figures possible in this business. I've interviewed over 150 people over the years, Vicki, that have told me that they have reached a 6-figure income just working from their home doing this billing for doctors. It's not rocket science. It's not even brain surgery. And there are articles out there that we've run across. Here's one off of CNBC's site. Why it might not be such a crazy idea to start a company right now. Now, the reason for that, if you read the article, is it says that this might be the best time to start a venture working from home. The virus outbreak could pave the way for new tech ventures focused on healthcare and medicine. So they're telling people, if you're thinking about getting into business, this is one that you should look at. In fact, if you're wondering if it's a good time to start a business, some of the hardest times that we've gone through in America, some of the biggest businesses have been started, including Airbnb, Disney, General Motors, Hewlett Packard, Microsoft, Slack, Uber, and Venmo. Those are just ones that started during the last recession. We went through that, Vicki, and we didn't seem to slow down at all. Our licensees just continued booming. Now, this COVID is a little different because it kept patients from actually going in and seeing the doctors, and even the licensees had a hard time sometimes seeing them. But now it's all opening back up. The doctors are willing to meet with them, and it's just booming. We've had licensees tell me on interviews recently that during the 2020, they actually doubled their business because they went in and actually saw the doctors virtually. So that virtual thing has really helped.
So, Patrick, I just really want to emphasize these 2 studies and that you showed the data from.
Yeah.
Okay, so the big picture is doctors' incomes have gone down significantly, They don't necessarily have the skills and tools to figure out how to right this boat. And then you've got doctors who are burned out. Last year, 42% of doctors reported being burned out, experiencing toxic stress sometime in 2020. And they said that what they would need to right that ship is more money. So here you've got kind of a chicken and an egg thing, right? You've got doctors unhappy because they're not making more money. They're unhappy and they say in order to get happier, they need more money. But the thing is, there is such a simple solution, right? It's just collecting the money that they are owed. And just something like that can turn things around for doctors in a very profound way. I will also say, is this the right time to start a business? My own business tripled in 2020. And some doctors that I know had the best years ever. And the thing is, if you've got a solution to a problem that people are losing sleep about, you've got a great business opportunity. And I think that you see the story as laid out. I think that this is a great business. Like if I were looking for a home-based business, I would become an ABS licensee. And I say that as somebody who does not have an ownership stake in ABS, but I say that as somebody who's started a lot of entrepreneurial ventures. Some didn't do so well, some did really, really well. But like there is a clear market and there is a clear path to revenue that doesn't have a cap.
There you are, folks. You heard it from her, not me. This is a doctor who's actually not only been in private practice, and she outsourced her billing, by the way, but she also knows what's happening out there with the doctors right at this moment. So you're hearing this live and as fresh as you can get from somebody who's actually been there, done that, and has the t-shirt. Here's another great quote I ran across in medical economics. It says, if you operate a medical practice, you should be outsourcing. That's the title of it. You should be outsourcing, telling doctors, if you are running a medical practice, don't do your own billing. Almost 80% of the survey participants felt very positive about outsourcing for the medical practices. It not only frees up your employees' time to work on the tasks that they were hired for, but it also unkinks your cash flow. Folks, that's what it's all about, cash flow. And boy, that's important in today's business environment. It's important anytime, isn't it, Vicki?
It is, but is it okay, Patrick, if I just share my billing story?
Yeah, sure.
All right, so I went through 4 years of medical school, 5 years of surgical residency, and it was time for me to launch into my career. So I was invited to join in with just a solo surgeon who wanted to invite somebody in to share his call and things like that. So I did that. And not too long after I came into the practice, his office manager of many, many years gave her notice. In retrospect, I think that she was probably embezzling from the practice.
Oh,
and
wow.
questions probably might have sort of triggered a, am I going to get caught kind of thing.
Right.
And this is one of doctors' huge fears about fraud and theft and embezzlement. So, you know, if this woman is just doing everything except the operating, she has lots of opportunities to help herself to the practice income. So anyway, we obviously needed somebody. We needed somebody to answer the phones, to do our scheduling, and to do the billing, because she had done that too. And my partner's wife said, well, how about if I just do it? I mean, how hard can billing be? I'll just take a couple hours away from my tennis game and I'll come in and do it. And it didn't take very long before she figured out that no, this was not really something that she could competently do, and that we needed to hire somebody else. So in the meanwhile, we had hired this temp, and oh my God, we were so in love with her. She was so nice with our patients. And a couple months after she left, we got a call from the temp agency saying, we're a little embarrassed to tell you this, But that woman that we sent to you, we just found out she is a felon convicted of Medicare fraud. So
Oh
if you've
my
got
goodness.
any irregularities in your billing, there might be a reason. But like by that time, who, who knew what was going on? We were so behind. That quarter, I actually had to make an owner investment to pay the quarterly taxes. So it was a nightmare. So I was invited to go to a different hospital where they were forming a multidisciplinary team to treat women with breast cancer. And I like that idea. So I broke away from my partner. I set up my own practice. And the one thing that I absolutely knew is that I never again wanted to be in a position where I was putting money into the practice instead of taking money out. So I decided the very first choice I made was that I was going to outsource my billing. And in retrospect, I think that that is probably the pivotal decision that helped me run a profitable practice, because it wasn't just doing the billing, it was like understanding the business part of my practice. Like if I were managing an ICU patient, I mean, we keep track of the fluids that go in and go out, but for most doctors, that basic cash flow, as you say, Patrick, it just, they don't take a look at that kind of thing. So
No.
I'm really, really glad I outsourced my billing. I sort of felt like there were checks and balances, right? There was not going to be somebody embezzling the money. I felt like outsourcing gave me a little more control, and doctors love control. So it was a great choice.
Yeah, I think a lot of doctors probably know that other doctors outsource their billing, but because they think they have better control over it, maybe with their own staff, in their own office, they are very protective of that. So it's a matter of educating them. That's one of the things we do through the books that we've written, is helping them to realize that it's really less expensive to outsource, and with the right system, a cloud-based system that they can have access to, they can see the status of their money and their claims anytime they want to from any device that's connected to the internet, including their phone out on the golf course. They could actually see what the status of their claims are. That is real control, and we and our licensees can give that to doctors.
Yeah. So let me tell you why, like the main reason I think this is such a good business. Okay, so I decided I was going to outsource my billing, right? So what did I do? I went and asked my buddies, hey, do you outsource your billing? Who do you use? Do you like this person? And when the same name kept on coming up again and again, well, that's the person I hired, right? Because the most influential person in a doctor's life is another doctor. So
Right.
once you get established as the go-to guy or go-to gal, your name is going to get passed around.
Yep.
And that is an exciting way to grow your business.
You just hit on the one thing that I tell people about this business, and that is, even though it sounds scary to find your first doctor, your first client, which is what we help you do, that's why you pay us a fee, is to get you to the point where you really can find your first client. But once you do, the doctors talk amongst one another. They know one another, and if they're happy with somebody who's increased their revenue, they will tell other doctors, in the lounges at the hospitals, out on the golf course, at church or synagogue. They tell and talk to one another, and the referrals would just happen automatically. All right, we got to jump into the return on investment potential of this business, because a lot of you got on this webinar because we, said we're going to show you how to make six figures. So here's how we do that, and you can prove it to yourself. Look, this is our website here at absystems.com. Just go to income potential at the top and click on the medical billing income calculator. Now, I've got Dr. Vicki on here who will stop me if I tell anything that's not true, right, Dr. Vicki?
Absolutely.
Okay, so let's talk about this. We've got a calculator that's already got some numbers filled in, so we'll just use what we see there. Number of doctors that you'd like to have as clients. Well, I hope you have at least one. And if you have one doctor as a client that sees an average number of patients each doctor sees per day. Now, we're talking about, post-COVID, but 20 to 25 doctors a day, a general practitioner certainly can see that many people, right, Dr. Vicki?
Absolutely.
And if they work 5 days a week, which some of them take off on Fridays, I guess, to just get caught up. And if you're charging just 6%, now folks, we haven't talked about this. You'll find this on our website. How you charge the doctor is a percentage of the money that you collect for them. So it ranges anywhere from 6 to 8%. Let's take the low of 6% and even a low of $100. I don't know that you could see a general practitioner for $100 nowadays, but let's say, just to make the math simple, that's what you would spend seeing a doctor. Okay, when you push our submit button there, you'll see that what your gross income would be from that doctor, just one doctor's office, would be $39,000 a month. Now, folks, let that sink in just for a second, and I'll tell you exactly how we got to that 39 with this slide here. One doctor seeing an average of 25 patients a day. Each patient is valued at $100 per patient. That's 25 times 100. That's $2,500 a day that doctor could be grossing, bringing in during the day. Now, your potential daily earnings would be, let's say, 6% of that $2,500, or $150 a day. For less than about 90 minutes, that's literally all it would take in our system for you to do those 25 claims during a day's time. So you've made $150 for working an hour and a half. I'd say that's pretty good hourly wage. But let's extend it on out now to 5 days per week. That's $750 a week times 52 weeks in a year. There's how we got to the $39,000 per doctor. But what if you were like some of our licensees who've got way more than one doctor? They've built, to 5, 10. You literally could do 5 doctors on your own. You literally could do the billing for 5 doctors without ever hiring another person. So if you get beyond that, you are going to probably pay somebody else to help you. But look at the potential. Here's the numbers that we saw earlier. We're going to plug in the 10. Everything else stays the same. And look at that. There's your 6-figure income right there. Yes, you can make $390,000 a year with just 10 doctors. Now, I'm going to show you that that's possible. Here's how I do that. We just interviewed someone that is one of our licensees. In fact, it's a couple, Brian and Laura Dean, and they gave me permission to talk to you about the fact that they will probably be bringing in 7 figures, not 6, but 7. And to prove that to you, I took part of the report that we get from our technology partners behind the scenes. We know exactly how many doctors somebody has signed up. And there it is. I know that's kind of hard to read on your screen. I meant for it to be hard to read because it's just basically their name, the type of a practice, and how many providers are in that practice. And there you can see that they're doing billing. Can you see that little number right down here at the small part of this? It's 169. Not 1, not 10, but 169. Are you convinced yet, Dr. Vicki? These people have really gone out and built this business, haven't they?
That sounds great. But Patrick, there's something else I just want to emphasize. So you were talking about somebody who does primary care. We know that the average specialist generates 5 to 10 times as much as primary care does.
Oh, yes.
So, probably my average bill that was sent to the insurance company was in the, $2,000 to $8,000 range.
You were a surgeon, right? Yeah.
Right. So, let's just take a number. The average fellowship trained orthopedic surgeon starts at $500,000, starts bringing home $500,000, right? That's after they pay their expenses. And so they're probably generating, $800,000-900,000 in billing in order for them to take home 500. And you get a percentage of that 800,000 or 900,000. So these numbers that Patrick shared with you, that's on the lower end. But if you get strategic and get known within, say, a group of OBGYNs or ophthalmologists, oh my God, I just got my cataracts repaired. And it was literally like a 10-minute case, $1,900 per eye.
Per eye, yeah, I know.
And they're just in there, just churning out these patients all day, every day. I mean, my mind was blown just trying to project what their billables were.
Yeah, I had mine done a couple of years ago, and each time I went into this office, the waiting room had like 40 or 50 patients in there every time I went in. And
Yes.
like you said, they were just running them through there. It only takes 10 minutes per eye and $1,900. Yeah, there's some money in that specialized surgery like that. Yeah, for sure. By the way, the numbers we just covered was just for billing. I already told you that there are other services that you can offer to doctors that we, include in your package. It's included in your license fee. These are other services that you can make money on. All of them are necessary to the doctor getting the maximum return, the maximum cash flow in their practice. And again, we teach you how to use all of these to open the doors, to get in, to talk to doctors, and to offer them to doctors. Now, let's talk about this because one of the things Dr. Vicki did when she came on board with me, she said, Patrick, why don't we write a book specifically aimed at doctors that talk about how they can grow their practice and thrive in practices. And so that's what we did. And now the big deal is that you can actually have your name on the cover. You see down there at the bottom, the forward by Susan Smith. Well, that could be your name right there because we've already written the forward that you can put your name on, or you can write your own. We've had a few people do that. And if you do, again, your name is on there along with your certification that we give you from the Medical Revenue Management Association of America, CMRM. That stands for Certified Medical Revenue Manager. You're not just a medical biller or coder, you are a medical revenue manager. And then on the inside page, of course, on the front page, you get your name there. And at the end of the forward, you actually can put your contact information. So Dr. Vicki, this was ingenious because this turns out to be like an inexpensive, really very powerful business card, really.
Yes, yes. So, of all of the marketing campaigns that I have helped my clients create when they want to build a business relationship with a doctor, I think that this model works the best. Remember, I just said the most influential person in a doctor's life is another doctor. So, the ABS licensees have their name like literally tied with mine. And, I'm very humbled and fortunate to have a nationally recognized brand. And so this is very powerful. I mean, imagine if the doctor said, "Yeah, I should probably outsource my billing," and I've had 3 people come in, and you come in with this book. Who do
Right.
you think that doctor is going to work with?
Yeah, we've actually had licensees tell us that they didn't even during the COVID they just would mail this book to the doctor's office, and it would just say on there, please, it was addressed to the doctor. So the person who would receive this kind of package that they could feel there was something inside of it, they would just put it on the doctor's desk. Well, one licensee did that, and I've got the interview that you guys can listen to. His name is Daniel. He says I did that by mail with a little personalized note, of course, included in there, and told them I wanted to give this to them. Well, call me if you think that we could help you. Well, we teach the licensees to mark these books. Yeah, they put little sticky tabs on here like you see here, and we also show them exactly what to highlight on each one of those pages. So when the doctor gets this book, they don't have to read the book. They can just flip through these tabs. They've never had that done before. What are these tabs? Okay, you're just naturally going to turn to those, and they read them. He had all 3 of those doctors call him up and say, you know what? I flipped through your book. I think maybe we need to talk. And he had an interview with 2 of them and signed 2 of them up. So that's the way this works, folks, is the power of connecting to a doctor, another doctor, like Dr. Vicki Rackner. And then, of course, you can put a sticker on the inside there that says it's compliments from your book, just however you want to use it. But we teach people in detail how to use that book, and we have other books that have come out on that as well. There's another page that was highlighted of the even out of the table of contents. And I put all these pages here just to kind of flip through and show you folks that we really have got some great quotes. Now, I'm going to put this slideshow in the handouts over there that you'll see. There's a handout section of the GoToWebinar, and you can download that at the end of the webinar here. But I just wanted to show you this. You can get those slides, blow them up on your screen so you can actually read them and take time to go through and see what we've marked in this book. It's not the entire book, but it's enough for you to see that we know what we're doing, and we have enough information in there that you'll see why doctors, when they read this stuff, will call you up and say, hey, I think I may have a problem here, come talk to me. Okay, well, that's enough of those pages. I'm going to move on past that just for a second here through
Okay,
some other.
but hang on, Patrick. While we're talking about books,
Yeah.
might I share my favorite business book that I've read last year? It's called Who Not How. It's by Dan Sullivan and somebody who works with him. And they say, people get this idea, I want to do this. I want to open up a home-based business and generate six figures. And the obvious question is, well, how do I do it? And this book says that probably the more strategic question is to ask, who can help me do this? So doctors are looking for more revenue, right? And you can be those doctors who. And you are probably looking for somebody to help you achieve business success as you sort of settle on, what business model is right for you. And the two people that you see here, Patrick and myself, we can become your who's too. So this team building, working with somebody with a track record of success and finding the right who's, right? Because there's sociopaths out there. There are people who are not nice, who do not have integrity. And one of the things I've learned about Patrick and his organization over 8 years now is he's the real deal. If Patrick says he's going to do something, he does it. And just his generosity with his licensees, we come up with new books regularly. And I keep on suggesting to Patrick, well, are you going to charge your licensees for these? He said, no, I've made a commitment to my licensees. I'm here to help them be successful. So Patrick, it is really an honor to know you and to work with you.
Thank you, Vicki. One of the things I did early on was say to my staff, look, when we tell people that this is an all-inclusive, one-time, lifetime licensing fee of $28,000, that's what it's going to be. Anything that we introduce, new services, like some of them you see illustrated here, or new marketing tools, like the postcard campaigns that we came out with, the folders that you see there, and of course these other books, the 3 other books that you see here, those will all just be offered to the licensees at our cost, basically. They can order those and use them, because the more money they make, of course, on the back end, the more money we make, because we make a few pennies on all the transactions that go through. So I said, let's not make money on nickel and diming people to death. Let's make our money on helping them to be as successful as we possibly can help them to be. I do see a few questions coming in here, so I'm going to address those questions. But first, am I even showing this? I don't think I'm even showing this slide, am I?
I see it. Yeah, I see it.
Okay, I paused it, I guess. Okay, so there's some of the books. One of them, as you can see, we actually put your name on the back cover, right underneath the blurb there about Dr. Vicki Rackner. You'll have your contact information, your logo, whatever you want to print there in that area on the back of the book. So we give a lot of different ways that you can market. And one of the ways that Dr. Vicki came up with, I thought was so generous of her, was to say, look, I want to partner with your people. I know that you're going to teach them how to do this. And of course, they have you as the nation's largest network of medical biller, behind them. I know they're going to do a good job. So I'm willing to introduce them to the doctors in your community. So Dr. Vicki, you want to explain why you came up with this letter of introduction?
Yeah, okay. So probably as you get started in the medical market, one of the biggest questions you're going to ask is, how do I get past the gatekeeper? How do I get the message really in front of doctors? Well, I've run my practice. I hired the gatekeeper, right? And she had 2 jobs. Her job was to screen out things that I did not want to put my attention into, and then to let things through that I would want to know about. And she could get in trouble by not doing either of these things. Well, if I got a letter from another doctor, that's not going to get screened out. I would have yelled at my office manager if she would have done that. So I thought, hey, how about if instead of you writing a note to a doctor, because that's almost going to be guaranteed to go into the round file. What if the letter came from me with my return address on the envelope? And this was just a letter of introduction. So here I just kind of tell my own story about why I think that this is so important.
Yeah, and I'm just amazed that people who've used this have said this opened doors for me that I would have never been able to get past. Just the fact that I included this letter, maybe along with one of the books that I left for the doctor, uh, and it just opened the doors because the doctor said, well, if there's another doctor that says, okay, I know these people, I trust these people, I'm on their chairman of the Medical Revenue Management Association of America. This is somebody that I can probably trust. And if you Google Dr. Vicki Rackner, you'll find out that she's well received all over the medical industry. So when they use this book, they feel like they've partnered with you. Folks, how much, Dr. Vicki, we should charge another $28,000 for this letter. This is worth a lot of money to anybody in a business that approaches other doctors. So thank you for putting that together for us.
It's my pleasure. It's my pleasure. And Patrick, we're all the time talking about how your licensees can be more successful, because that's the bar. Ultimately, I know that Patrick is worried about your success. He wants to help make you more successful. And we go through brainstorming sessions where we come up with stuff like this. So it's not just me, it's me in collaboration with Patrick.
Yeah. And here's the thing, folks. We, again, don't charge any extra for you to connect with Dr. Vicki Rackner, although she charges big bucks for people outside of our network. Financial advisors, for example, can pay her up to $10,000 for a personalized book like you just saw. That's included in our package. So what value there is in our package, folks, you cannot even imagine until you look in detail. Ask your ABS rep more about that. Hey, by the way, Dr. Vicki, we're right here towards the end of the webinar, and I've got a few questions that I wanted to ask you and that have come in here in the question box. Folks, we only have about 15 minutes left. If you think you would like to ask Dr. Vicki a question live, we'll read that out loud here to everybody and just use your first name. So it's very anonymous in that respect. And you can share that question and answer with everybody that's on here, because we got a big crowd here today. So, well, one of them is one that I can address. Julie is asking, after the $28,000 investment, do we own the software or do we just get access to it as long as we have our billing company? Well, Julie, since it is a cloud-based system, there's nothing to own as far as having something that you can touch and feel and so forth. But I will say this, it is a lifetime license, so we would never take that access away from you. You literally have access anytime you want, anytime that you have a client, or maybe you put this on the shelf for some reason. Maybe some emergency comes up in your life and you can't work on the business. Just put it on the shelf, and a year later you take it off. It'll still be there, accessible by you. The same with all of our services. They're all cloud-based, so you have logins and access to all of those at any time that you want. Okay. Let's see. Dr. Vicki, I wanted to ask you this question, because I know a lot of people have wondered about the types of doctors to approach, and you've already mentioned that specialists would be a great thing to go after. Are there other specialties that you can think of besides surgeons, for example? What about podiatrists? Do they do a lot of, well, they do surgeries too, don't they?
They sure do. They do operations on the foot and ankle, and they can be very good. But I'll tell you, Patrick, I think that finding your tribe, the group of doctors that you serve, and maybe finding maybe 3 or 5 of these tribes, it's kind of like choosing a life partner. Like, every different group of doctors have different temperaments. Like, pediatricians are really, really different than neurosurgeons. And you will probably find that you just click with a certain kind of person better than another. Just like if you were dating, you might have a list of things that you might look for in a partner, but then once you get out there, it's sort of like, wow, we're a really good fit. So like, I remember working with somebody who said to me, I always wanted to be a cardiologist, but then life got in the way. Well, of course, cardiologists were a natural fit. I was working with somebody else who was diagnosed with colon cancer at a relatively young age, and his colorectal surgeon and his oncologist cured him. And so those were his natural tribes. That's who he was able to go out and say, you know what? You guys saved my life. You're going to let me see my kids graduate from high school and hopefully walk my daughter down the aisle. And, I would just love to give back to you by sharing my gifts. And my gift happens to be helping grow wealth. And while I've worked with financial advisors, I will tell you that your core mission of helping doctors put more money in their pockets, you and the financial advisors very much align. So, um, you know, you can think strategically about how you grow your practice. And maybe you want financial advisors who work with doctors to be your power partners. So look inward. Has a doctor made a difference in your life? Do you feel drawn to a certain kind of doctor? Usually when you listen to that kind of thing, you wind up with the best fit of your doctor client.
Yeah, in fact, I have a list here that I think I'll drop this in the handouts also. This is a list of medical specialties. Now, look, it's not just this page, it's another page, about a half a page. And as you can see, there are a lot of specialties that are out there. The thing is, people don't know where to start usually. So we narrowed this down to about 10, I think, that we teach people that these are the ones that you should first go after because they, again, would make the most money. But I've had licensees tell me that they accidentally ran across, I don't know, a gastroenterology doctor.
Good job, Patrick. Good job.
Gastroenterologist. and that happened to be their first client, just accidentally almost. But then that person knew another person in that specialty, and that they became a specialist in that type of billing. Not that there's a whole lot of specialty to it, but it's just amazing how simple and how much alike all of it really is. You use the same software for all of these people. But anyway, I think I'll drop that in that handout section as well. Okay, here's another question or two that have come in. Let me zoom in here so I can see this a little bit better. Okay, I'm new to medical. This is from Ola O'Clooney. I'm new to medical billing as a whole, and what I've heard so far has been really interesting. So I'd like to ask, how would we be able to get doctors to work with? How easy or difficult is it, and how long does it take to get my first doctor? That's a question we have asked a lot. And of course, it all depends on how much time you have available. Are you going to be working full time at this or part time at this? You probably have the same question asked by your financial advisors, right? I mean, if they're brand new, how long am I going to take to get my first doctor connection? What do you tell them, Dr. Vicki?
What I say is the rate at which you build your practice is the rate at which you build trust. So the very first thing that you want to do is just sit down, get out a pencil and paper, and think about the doctors who are in your own circles, your own community, maybe your neighbor, maybe a relative, maybe somebody at the church or synagogue or mosque, or the parents of kids who are on your son's soccer team. Chances are pretty good you've already got doctors in your circles who already know, like, and trust you. And then you can just go out and announce, I'm on a new mission. I'm on a mission to help doctors thrive in private practice. And I've got some free resources. If you know anybody who would be interested in those, have them contact me. And then, maybe give these people 5 copies of one of the books. And then just start, like, giving them little pearls of wisdom. Because remember, doctors are in pain right now, right? And if you can be the person distributing these simple, great ideas, you're going to naturally draw doctors to you. And that's where I definitely recommend starting. People who already know, like, and trust you.
That's a good point. People don't realize one of the things we do in our training, our online virtual training, is we guide them through a process of figuring out who do you know that might know a doctor. Maybe you think, well, I don't know any doctors except my personal doctor, but people that you know doctors, and that's who you want to connect with in your community. People
Right.
who are already either doing business with doctors or just happen to know them. One lady said, my first referral was from my mother. She just happened to overhear somebody at the front desk saying something about the fact that they, were having trouble collecting, billing, so forth. And so she just referred her to her daughter and she signed her up. So you never know.
Happy Mother's Day. So I get my hair cut. I got my nails done. And I'm probably not the only doctor who sits in that chair getting those things. So anybody that you're networking with, if you know a dog walker, you just never know. But these tend to be powerful, powerful things. And by the way, you don't want to pitch your doctor, right? You don't want to try to get your own doctor as a client because there's pretty sharp boundaries around the doctor-patient relationship. But you can thank your doctor. So imagine taking one of the books, right? One of the books that you would have access to, and then going on to a page with the name and writing a little note. Dear doctor, thank you for your service. Here's how you made a difference to me and my family. I just wanted to give you this book as a thank you. And if you know other doctors who'd be interested in this, let me know. I'd be happy to send more books.
I love that. I've never heard you say that before. That's a terrific idea. You've been withholding from me all these great ideas. I can see that we have to have some more brainstorming sessions.
Oh, you know me, Patrick. I'm coming up with a new one every day.
I know. I can't keep up with you. Okay, here's another question here from Julie. I don't know what you're talking about there. She says something about, can you give me more detail on the monthly payment? I'm not sure what that's about there, Julie. You might clarify that for me. Okay. So, I mean, to address this question, again, more generically, it is not an easy thing to get a doctor's attention and to get in front of a doctor. And so that's why we have all these tools. It'll depend on how much time you're putting into this, because again, if you're just working part-time, it'll going to take you a lot longer. But we've had licensees take up to 6 months to get their first doctor. They look at it like this: even though they're working a full-time job, they're doing this part-time, they finally get that doctor in 6 months, and that's a start. Then they start doing billing for that doctor. They're making whatever, $39,000 a year from that doctor. All they need to do is do a good job, get referrals, and start building that thing slowly but surely. We've had others finish our training and literally have their first doctor in the first 30 days. So that all depends on you as an individual. But we'll, again, work with you one-on-one. That's why we have individualized training for everybody to help you figure out what's the best way for you to get started in the business. How long is the training, says Doreen, for the certification? How long is the training provided for the certification? Well, Doreen, you can take that training literally within, the first 30 days. There's about 10 modules. They're about an hour and a half each. But if it takes you 6 months to go through that, that's fine too. You can stretch it out as long as you want to. You have access to it anytime that you want to. Dr. Vicki, I've only got 3 minutes left. I'm going to wrap up with a few last slides here. Thank you so much for taking time. I know you're up there in Minneapolis still fighting the winter. Down here, it's about 80 degrees in Texas. So just wanted to share that with you.
Thank you so much. But it's actually beautiful out here now, Patrick. Perfect gardening weather.
Oh, good. Glad to hear that. Well, thanks again. I'll pass along any questions that come up, from other people through the question box here to you. Thank you again.
Okay, my pleasure, Patrick. And for all of you who were listening, thank you for your time. I just want to honor your wisdom in exploring this. I think this is a great business opportunity. So bye-bye for now.
All right. Thanks again. Folks, there you go. You heard from a real medical doctor who thinks that this might be a good decision for you to get into. Only you know that. But hey, if you make this decision and decide it's not a good idea, we have a money back guarantee. Yes, I'm the only company that I know of in the United States, the only business opportunity / franchise that you can buy and get into. And if in the first 30 days you don't like what you hear, you simply ask for your money back. That's right, 100% of your money back. Has it happened? Yes. But it's less than 0.5% of the people who come through our training. So we're not worried. We know what we have and we know it's a good thing, and it's open to you anytime you want to. Let's see. Somebody's asking about the tabs to highlight for the book, and when are you going to provide the include highlights? Yes, we're going to do that. In fact, I think what I'm going to do, Nevin, is put that in the handouts for today. That's a good idea. I'll send a copy of that to the handouts here, people who just hang in here for that. Now, let me tell you the steps you can take if you're still interested in finding out more about our business. We have a research guide that's over 50 pages. It's a PDF document, but it has information that's not available to the general public on our website, so you have to ask your ABS rep. How do you do that? You can email us at the email that you see below, or the person who invited you to this webinar is your ABS rep, or you can call the phone number that you see there. Browse our YouTube channel if you want to see interviews that I've done with literally over 150 licensees about what their success is in this business, and you also can get a list of those people by asking your ABS rep for an owner reference list. So go to YouTube/YABS to look at those videos. Ask for a live demo. We'll show you our iClaim EMRX platform live over the internet, logged into it as if you were actually using it, by just letting us know that you want to see that. It takes about 30 minutes or so, or you can take as long as you want to, ask as many questions as you want, and we'll guide you through that one-on-one. Then review the purchase agreement, which your ABS rep will send to you, and they'll also give you some information about how you fund this business. And then send in your agreement and funding and schedule your training with your instructor. Yes, we'll put you in contact with the instructor. Now, let me just say this. At this time of the year, the training is a little bit hectic right now, but we do have some slots open with our lead instructor. Yes, our lead instructor who's been with us for at least 5 years now, teaching this one-on-one virtually using GoToMeeting. It'll be just you and the instructor, nobody else, unless you invite somebody else to be on there. And you will be able to schedule that with your instructor. Her name is Cynthia, and she has got a few slots open if you want to get trained by Cynthia, who's got her own medical billing business and is doing really, really well with employees and doctors all over the country. You're welcome to let us know, and we'll put you in contact with Cynthia.